Okay, so before we get started, in the spirit of reconciliation, I'd like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respects to elders, past and present, and extend that respect to any Aboriginal and Torres Strait Islander people joining this webinar today. My name is Bree, and I'm joining today from the lands of the Murrumarang people on Yuin country. If you do know what lands you're joining from, I do encourage you to share that in the chat. So welcome to today's webinar on supporting country kids. And I'm very delighted that you've joined us for what I know is going to be an incredibly valuable session. I'm personally looking forward to it because I'm interested to know a lot more about what Royal Far West do. So for families raising children with disability in regional, rural and remote areas, accessing the right support can feel like an uphill battle. Long distances to specialist services, extended wait lists, and a sense of isolation are challenges that many of you may know too well. So today we're very excited to have Fiona from Royal Far West joining us. And Royal Far West is Australia's leading charity dedicated to supporting country kids and their families. So over the next 30 minutes or so, I'm going to be firing some questions at Fiona. And hopefully we are going to get some answers around how Royal Far West is bridging the gap and bringing accessible care closer to families who need it most. Fiona brings decades of experience as an early intervention special educator, and has been instrumental in shaping programs at Royal Far West. And her combination of professional expertise and personal understanding of country family challenges makes her perfectly placed to guide us through today's session. So I'm just going to start firing questions at you, Fiona.
Sounds good.
So, look, I imagine that there's families that are watching this webinar who have never heard of Royal Far West before. So let's start by, can you tell us about who you guys are, how this organization started, and what makes it unique in supporting country kids?
Okay, well, I guess you can see from my background, we're 100 years old this year. We started in 1924 with the Reverend Stanley Drummond, who was a Methodist minister, a rural minister from Cobar, who was recovering from surgery on Manly Beach and said to his wife, "Wouldn't it be lovely if the kids could come and do this?" And so they went back home and literally raised money to start the first camps, which came down here. Then Dr. Baron Moncrief Barron, who was the Macquarie Street surgeon, saw the children on the beaches, a lot of them having quite significant physical needs. And the famous line was born, "You look after their souls and I'll look after their bodies." And so from then on, children came down annually for about 3 years. And then their local community, one of the women was an ex-nurse who had a boarding house, which is what we now know as Drummond House, and kids could come and stay, and it became longer. So children came without parents and stayed with us for a few months, sometimes a few years, just depending on what their needs were. We then evolved into a polio hospital, and so I had lots of children who actually resided here for many, many years. In the early 90s, in the early 2000s, we not reverted, but we became about parents coming as well. And so children and their parents now attend with us, and we sort of have two areas where they go. So we have our paediatric development program, which is coming in for assessment and diagnosis, and we have our NDIS therapy team, which was previously known as Windmill. Some people have heard of Windmill, and it's been just rebranded as that NDIS therapy. I can see Sam's question coming up here. Is it only for New South Wales residents? The paediatric development program it's funded by New South Wales Health, but our NDIS therapy, no, is for anybody wishing to access that service.
Amazing. So much history. 100 years. Wow, that's incredible.
Yeah.
We will talk a little bit about the eligibility in a moment, but what would you say are some of the biggest barriers that country families face when they're trying to access support services?
I think for any family, it's access. You know, it's dreadful. And as somebody who, as I said, have spent most of my career in early intervention, it just does my head in that, you know, you wait to get your NDIS package, then you spend 12 months at least waiting on, you know, wait lists for therapists. It's just, you know, multiplied for families in rural and remote areas where there's not very many therapists at any rate. So yeah, that is the biggest problem. And I think also too, one of the things that's happened with the NDIS is because it's become such a transactional model, at a marketplace, you may not necessarily have the best therapists in the areas, and that's another very tricky piece. A lot of, you know, new grads are ending up without a lot of supervision and support to then be able to deliver, you know, quality programs to families.
Let's talk a little bit about that eligibility then, like, 'cause I'm sure a lot of parents are wondering this. How do they know if their child is eligible for Royal Far West services? You know, are there age limits? Is there specific criterias that families need to meet for the services?
Mm-hmm. So for the two streams, so the PDP program, that needs a referral from initially it's supposed to be a paediatrician, but as there's less and less paediatricians rurally, we will now accept referrals from a GP. That child has to be aged between 2 and 12, and they can't have a diagnosis. So we don't do second opinions. It would only be if there was a lot of additional concerns for a child, for instance, that had an ADHD diagnosis, and they might be looking at autism and OCD and some of the other things, that they would be accepted. In the NDIS therapy, it's the same age bracket, 2 to 12, and mild to moderate disability. So we just don't, unfortunately, have a physio on board, so we can't look at physical disabilities at this stage, and children that might be high risk. So those children at this stage, we're not able to see they're out of scope at the moment.
Yeah. And does location come into this? So I know for either program, like, is there kind of, I guess, a line that goes
Yeah,
around a
there
certain
is
area that
there
says
is a line.
yes?
There is
A
a line,
squiggly line.
a very squiggly line. For the NDIS therapy, it's really metropolitan, so Sydney. Okay, so we won't see kids from Sydney. We will see kids outside of Sydney, so Central Coast, you know, Blue Mountains, over the Blue Mountains, and the South Coast. We're not as strict on that area coding, simply because the PDP has to be, because it's funded by New South Wales Health, and it is more rigid. So it is, you have to be north of Taree, you have to be west of the Blue Mountains, and you have to be south of Nowra. So it's a bigger, sort of a 200-kilometre circle, if you like. But we, and also Queanbeyan. We don't see kids from Queanbeyan as well, and that's simply because of those funding guidelines. The NDIS therapy children, the only thing that might affect them is coming in to visit us. Currently, IPTAS, Isolated Patients Transport Travel Scheme, you never can get the whole acronym out, covers accommodation and food and you know, transport a small kilometre. That will not cover NDIS families who are coming from interstate, because it's clearly funded by New South Wales Health. So that's sort of the area, the geographics of where we won't see, but you know, we're right out. We see families in Broken Hill, families from Broken Hill coming to us. You know, wherever the need is, basically, we're there.
Amazing. We have just had a question in the chat about how about Gold, New South Wales?
Gold, yeah.
Yep. Okay.
Yes,
I'm not familiar with where that is, so.
I know Gold, yes, absolutely.
Okay, so when families, I guess, first reach out to Royal Far West, like, can you walk us through what that typical first interaction might look like and what should families expect when they first reach out?
Okay. So again, the two streams. So with your PDP, you need the referral. That's the first place to start, and that referral, as I said, comes from your GP or your PED. From that, there is that eligibility triage of the age and where you're coming from, and diagnosis. And if those things you meet eligibility criteria around those, you will then receive from us a parent carer questionnaire and a school questionnaire. And then once that's completed, you will go on to the wait list. And the horrible part about that wait list currently is between 18 and 24 months for assessment diagnosis. The NDIS therapy arm is you don't need a referral from anybody, it's self-referring. You contact, and on the website it has how to contact the NDIS therapy team, which is a form online. And then somebody from that team, the planners, will get back to you and talk about what it is that you're looking for, and make sure that, again, that eligibility, we can't see 16-year-olds. We just don't have that expertise or professionals skills in that area. So it's just very simple eligibility criteria there. And that wait list varies to come in for what we call an immersion week. That's about 3 to 6 months waiting. And our therapy, direct telecare therapy, is a little bit longer because we do service agreements for 2 terms. So you've got approximately 6 months wait list there as to what's happening once those service agreements have expired.
Okay. You mentioned that you don't have a physiotherapist, but what other kind of professionals can families access through Royal Far West?
So we have speechies, OTs, psychologists, one lone special educator, social work. So they're the current staff that we have for people to use their NDIS funding with. Yeah.
Yeah, amazing. And I think you said telecare. I'm assuming
Yeah.
that's telehealth. Are we referring to?
Yes. So we're in part of this 100 years, what I should have said is we were one of the very early people to offer telecare. So
Yeah.
and that was the name of it. Before telehealth was even
Yeah.
thought of, we were offering telecare. So that goes right back to sort of when did that start? About 2010.
Yeah.
One of our speeches.
Very pre-COVID.
Yep, absolutely. Very innovatively started working. It was called See and Speak at that stage, so it was only speech. And so when COVID hit, for us to actually sort of flip and be able to be really flexible and nimble, we already had the things in
Amazing.
place. Yeah, yeah.
So I guess as well, like for families, like how effective have you found, those telecare services, especially for like young children who might find it hard to engage through a screen? It sounds like you guys probably pros at it by now, though.
As somebody who's done it, it's a lot of hard work. It's
Yeah.
really hard. Because when you're in a typical therapy session, if you can see that therapy session is going sideways, you can pull out your bubbles and blow bubbles, or you've got those things at your fingertips, and so that can be quite challenging. Making sure that whoever is the support person. I think the most important thing is that is never delivered just to the child. It is always delivered. To either into the schools. Some families choose to have that delivered into the schools, and so the SLSO or the teacher's aide will be supporting that child. And my preference is always into a home for the family. So one of the beautiful things about this is that it's about we become facilitators. So it's too easy sometimes when you're with a child. I mean, I'm a terrible one that I want to, I have to sit on my hands because I want to make that puzzle piece and move that around and, help that child. I'm very, hand on hand. And that's one of the things with telecare. Obviously, you can't do that. So it becomes a big strength of that is that you're facilitating those sessions for the families to be the doers with the children,
Yeah.
which, as we know, has much, much greater outcomes than just a single therapy session. It
Absolutely.
is so much. We don't say capacity building, and we say capability building, and it
Yeah.
is absolutely and utterly capability building, and that's what I love about it.
Yeah.
It's, as I said, it's really hard. It's not easy, but that family really learn how to do those strategies, and as well as the SLSO. And the beauty of that is that they are then incorporating that in the classroom when they're supporting that child. So it's not just that child that's learning. So it's actually, I guess, the absolute key to inclusion. you know,
Yeah. Yeah.
it
I,
just
I love
becomes
that.
normal day, everyday activities, that you're doing both at home
Yeah.
and at school. And the little sort of caveat on that is that when it's delivered into school, the therapist also has to engage with the family and, you know, Zoom conversation or whatever it is to go through what they're doing with the child and how,
Yeah.
what those strategies look like, and give the families that support to also enable them to do it at home.
I love that model. I just think, yeah, when you can build that capability of everybody that's supporting the child, yeah, there's so much more room for success.
Absolutely.
Um, so I guess for families who do live hours away from major centres, you did sort of touch a little bit on the IBTAS, but what kind of travel support or accommodation assistance does Royal Far West provide for those in sort of that non-NDIS stream?
So, well, both streams. Again, we've got some really good, strong relationships with Little Wings, and Little Wing, particularly. This is important if you've got a child with level 3 autism, a little one, for instance, and you're coming in, and you've got to spend 5 hours on a bus, and then another 10 hours on a train to get here. That is just not. That's not going to set up anything for success. So Little Wings will fly kids to us down to Sydney, and then they will drive them out to Manly, to our accommodation services at Manly, which is really lovely. And I think just it makes such a huge difference. And our social work team will organise that with families who that is a priority for them.
Yeah.
That's the most way that we can support, other than the IBTAS, which gives you that kilometre um,
Yeah.
payment.
And is there a cost for families when they come to the accommodation?
No. So
Amazing.
under IBTAS, you one parent, one child is accommodated. That includes staying on our site. So anybody who's been to Manly or seen anything in Manly, we're doing this huge redevelopment. And unfortunately, our next door to our Centre for Country Kids building, which is Drummond House, is in a station. It's being a phoenix and rising again. We can't wait for that to happen. But in the meantime, we have a sort of smaller accommodation about 15 minutes away from us, and we run shuttle buses backwards and forwards. So you get your own private room, bathroom, whatever. We give you breakfast and lunch every day. And you can, I think there's, 2 nights a week, there's meals, there's a barbecue and a spaghetti night, and then it's sort of up to the families to do. We've got Coles across the road. So, we encourage people to go and get a barbecue chicken and fish and chips and all, we're Manly. It's just beautiful, really.
And I imagine for some families that might be coming from quite isolated regional areas, it's probably a great opportunity for them to connect with other families that are walking a similar path as well.
I think to me, that's the power. Having spent, as I said, most of my career in early intervention, I know without a doubt that networking and that ability to be able to share the journey with someone who's starting with you, maybe a bit further
Yeah.
on, maybe way further on, and the support and knowledge and expertise that those families can share is invaluable. And I think actually one of the most important things we can do, whether you're here for therapy or whether you're here for PDP, we make no distinction between those families. And yeah, the conversations so powerful. It's just
Yeah.
wonderful.
It's where the magic happens,
It
isn't
is
it?
absolutely, absolutely. I love it. Yeah.
Would you say that the wait lists for Royal Far West services compared to mainstream services are like in Sydney metro areas and that are pretty similar?
In terms of therapy,
Yeah.
yeah. The,
Yeah.
the look. I actually think our therapy is probably a little bit better than other areas. You know, I'm hearing from families that they people won't even take them on a wait list until they've got an NDIS number. So you know they're spending 6 months waiting to get their package, and then they put their child's name on the wait list for 12 to 18 months. You know, so there's 2 years almost gone,
Yeah.
and it's
Yeah.
pretty similar. Yeah.
Without sharing anyone's personal details, can you give me an example of how Royal Far West has made a difference to a country family? I'm sure you've got heaps,
I
just
don't,
one or two.
yeah, that's gosh, there's so many. I think one of the really early families, that was a family that I worked with, um, were from Cobar, and this little boy was just a joy. Level 3 autism, youngest of a family of 4, 5. I think he was the fifth, and he came down to see us and was, you know, a challenging little fellow, shall we say. And I sort of talked with Mum about what were her goals, and it was really that he could communicate with her. So we did a whole lot of work on just two things, really: that he could sign more and finished, and that we started introducing visuals so he knew, you know, what they meant. And they came 3 visits, I think, for a week with us. And at the end of that, the feedback was so beautiful, where Mum said, "You gave me my boy back." And it still brings tears to my eyes, because it was so lovely that she had now developed a way to communicate with him. And that little boy has gone into, I might add, mainstream school, and is doing really well within, you know, that schooling system, which is pretty fantastic. But that is one that really does make such a difference.
Yeah.
Sorry, now I've got to try and.
No, that's beautiful. And I actually got some goosebumps when you were telling that story. Look, I feel like you probably already explained this, but what's the most rewarding part of your work with the country families?
Um, I think that when I meet families for the first time, their shoulders are somewhere up here like this. And I absolutely love it that by Friday, they're back down here, they're feeling strengthened, they're feeling empowered, and they have this beautiful hope back, you know, that has been destroyed. In some instances, not every instance, but some families really do come in quite distressed. And I think that's lovely to be able to uh, support families to feel that it's okay, you know, that this is still your beautiful little person, you know, and that you've now got ways of helping them that will be life changing.
That's incredible. Okay, so what advice would you give to a parent who might be watching this webinar, who is sitting in a remote or regional area, who feels completely overwhelmed and doesn't know where to start?
Um, that is such a good question, and it's kind of, you know, one of the things that I think these new foundational supports are going to be looking at, of having somebody that's going to be walking along beside you. And, you know, in the early childhood sector, it will be the key worker, and then after 9, the navigator. That's still to come. But in the meantime, I think get on the phone, ring up and have a chat. One of the things that I think is really incredible is things like Raising Children Network, that has got some fabulous resources on it, of, you know, what to look for with a therapist. Um, Very interestingly, I keep hearing lots of things about parents being told to sit in the corner, or, you know, go out of the room or whatever, and, you know, sort of break all the best practice guidelines. So I think, you know, families need to be, and sorry, Raising Children Network talks about those sort of things. And I think that's really important that families have that understanding that they have the power. It's not just allied health dominated, that it's actually the families. And I would look for people who work in team around the child practice, where the child and the family is at the centre of everything, not just something peripherally over in the side.
Yeah, you did, like I know you just mentioned the best practice guidelines, and they are about to release the updated best practice guidelines. So we'll be sure to share a lot of information about those new guidelines when they come out. Um, so for those families who might be hesitant to reach out because they're not sure if their situation is serious enough, what would you say to them?
Um, I'm going to always go, if a parent has a concern, they know your child best. So it's, if you think there's something wrong, then I would be reaching out. At the moment, we only have the partners, the early childhood partners, but I would be reaching out to them and speaking to them, and finding out, what the eligibility criteria is, and starting there. Um, I think too often families aren't confident enough to say this is not right, or if they do, they're told, oh, don't worry, they'll be fine. When they get to school, they'll be fine. Again, I'm early intervention. That's too late. If you've got concerns, 10 months old, talk to your GP, talk to the partners and see.
Amazing. Well, we do have a question in the chat just around for people that might be interstate. What are they able to access the NDIS support?
Yes.
Yes. And is that just through obviously telehealth?
No, they can come for what we call an immersion week.
Yep.
So we actually have quite a lot of families who are accessing telehealth interstate. So we have quite a few up in Queensland and Victoria, and we do deliver also into Western Australia. What I was going to say was I guess the immersion week, which we were talking about before. That's where they wouldn't be able to access the funding for the accommodation, but if there's STA in your NDIS package, respite, you can use that to attend there.
And for that service, sorry, is there an age limit? The person in the chat's asked.
Is 12 as well.
2 to 12. Okay.
Yeah, 2 to 12. And we will we say 2 because before that it again, it's having that expertise to work with that, and 12 is sort of that transition time, which we felt was really important to have a lot of year 6 before they're moving on. So sometimes we've got 12 being in year 7, but most of it is that's primary school. Yeah, yes.
Incredible. Well, I've thrown a lot of questions at you. Is there anything that you think that we've missed that you wanted to share?
No, look, I think the most important thing is, when this program was developed, it was always about creating the opportunity for the family to be the powerhouse. And it wasn't to be reliant on never-ending therapy. And that key principle still is there, 10 years later that we've been running it for. And I think that's so important. And also that, the therapists that are here are having supervision and PD and all these wonderful things. So they are really incredibly supportive of families. And again, because we may see people only once for one immersion week, and never again, but we make sure that they've got a whole lot of strategies to keep going with when they go home. Yeah. And people can access an immersion week and then move on to telecare and vice versa. It's absolutely, it depends on their package. And I guess the only other thing is to say that you build that package. So, sorry, what you're accessing. So if you want speech, OT, special ed, you build it. You say these are the sessions that I want.
Oh, that's incredible. Just one last question that's come
Yeah.
through, just around autism assessments.
Yeah.
So how would something like that work with Royal Far West?
So it's the same as it's part of our PDP. So they would get a referral from their GP, and if you go onto our website, in the drop down box that says what do we do, it will, at the bottom of that drop down, it says Royal Far West. I think it says medical referral, is the actual term, and your GP needs to complete that. And you put down, why the reasons that you're looking for referral. So, query autism. Again, the worst part, 18 to 24 months wait list at the moment.
Thank you. Thank you so much. You've answered so many questions I've thrown at you. Um, I know the audience and I know myself, I've gained so much of a clearer understanding of how Royal Far West can support families and the practical steps they can take to actually access that help. For those who have joined us today, I hope you're feeling a little bit more informed about the support available and perhaps a little less alone in your journey. The work that Royal Far West is doing to bridge the gap for regional, rural, and remote families is truly remarkable. And yeah, just the history of it is incredible. If you have any questions that we didn't address today, please don't hesitate to reach out to Royal Far West directly. We will include their information in the follow-up email with a link to the recording as well. Um, Thank you again to everyone who's attended live. A special thank you to Fiona for generously sharing your time and yeah, your knowledge with us, your dedication to supporting country kids and their families. Yes, it makes a difference. You can just tell in those stories that you shared earlier. Yeah, it's such a lovely service. And I'm a regional family, and I know of a few families in my area who have connected with Royal Far West, and it definitely has made a difference to those families. So we hope today's session has provided those practical next steps and renewed confidence in accessing support that your family deserves. So take care, everybody. We look forward to connecting with you all again soon. Make sure you have a look at the Belongside events page. There is always something happening. So have a wonderful rest of your day, everyone. And Fiona, thank you so much.
Thank you. Thank you. Bye bye.
Thank you. Bye.